everyone? Today we're here with Dr. Naseem Musharbash, who's a first-year oral surgery resident at Highland Hospital in Oakland, California. Naseem, thank you so much for taking the time out of your busy schedule to, help us dental students out today.
Yeah, of course. Thanks for having me. Appreciate it.
Yeah, of course. So can we just get started with kind of hearing a brief description about yourself, like where you went to dental school and, where you're from originally?
Yeah, so I grew up in SoCal, actually, born and raised in Chino. I went to a local undergrad, Cal Poly Pomona. From there, I went straight to UCLA Dental School, where I did my 4 years, kind of went through the whole oral surgery track, and now I'm up in the Bay at Highland Hospital.
Very cool. And how did you know, or when did you know that you wanted to pursue oral surgery?
So I kind of got a hint of oral surgery towards the end of undergrad. One of my now mentors, Dr. Max Moncayo, actually came and presented on oral surgery. And he was an oral surgeon in the Navy. So he saw all this crazy stuff. And he was showing us slide after slide. And it was funny because one of our like club mentor, whatever it was, she was sitting there in the back eating her lunch, and he was just showing like maggots on the scalp and just crazy stuff. And she was like about to throw up, and I was really excited about it. So at that point is when I kind of got my initial interest in oral surgery. And then it wasn't really until dental school where I got to actually shadow in the oral surgery clinic and see more of what an oral surgeon actually does, where I discovered like, oh, this is actually something I want to do for the rest of my life.
So when did you begin shadowing? Were you able to do that in D1 year?
So at UCLA, we technically were. I never did because also I was part of the COVID class. So my second quarter, we went straight into lockdown, and we didn't come back until around August. And then that's when I actually came back. I had already taken the test at that point. That's probably something we can talk about later.
Yeah.
But I'd taken the test. I went back and I was like, all right, let me see if this is actually something I want to do. And I was going in maybe 2-3 times a week, just hanging out with the residents and like having a great time. And I knew that was exactly what I wanted to do.
And so what was it specifically about oral? So it got you excited when you like watched the presentations from your mentor, but like, what do you think it was specifically about oral surgery that just really enticed you?
I think it's the expanse and like the knowledge that comes with like being an oral surgeon. And this is something I talked about in my personal statement too. I have kind of a personal story with my dad. He was in the hospital, and like I kind of felt like I wanted more out of my career, and I wanted to be able to do more. And so it started off with Dr. Moncayo being able to see what he does. I saw what the residents were able to do, the training they underwent. And so just the expanse of like the knowledge, the skills they gain during residency, no matter how hard it is, it was just absolutely amazing. So that enticed me overall to really go for it. Just be able to wield that kind of knowledge and those skills. It's just so exciting.
That's awesome. So that leads me to my next question. Why did you choose a 4-year program, right? Because Highland Hospital offers a 4-year program, especially when you say you love, like gaining all this knowledge and, the power that comes with it. Why didn't you choose the 6-year program where, you could go to medical school and maybe have even more education there?
Yeah, that's a great question. So I kind of had that debate with myself also, because I applied to both. I interviewed at both. But at the end of the day, like my goal as a kid, I knew I always wanted to kind of open my own business. I had my own entrepreneurial efforts going. Like even now, I still run my own businesses. And so I knew I wanted to end up in private practice. And an MD wouldn't really help that much. And just going to a 4-year would be the quickest way through that route. Now, for sure, if I went to an 6-year program, I would have appreciated like a formal training in medicine, but I don't think I have like a true lack of training in that sense. I still self-study a bunch of medicine at home to be able to like actually function in the hospital, because there's still a lot you need to know. But I definitely would have appreciated that extra 2 years in med school. But like knowing who I am and having like a real conversation with myself, I was going to end up in private practice. Those 2 extra years weren't going to add anything to my life or like push me further closer to my goals. So I knew a 4-year would be the best route for me personally. But for anyone else that's thinking about the difference between the two, like if you want to do the MD track, if your mindset is like, I want to be an attending, or I want to go into research, I want to do a fellowship, whatever it is, the MD route, not that you can't do it in the 4-year, but the MD route just opens up a little more doors for you than the 4-year does.
Gotcha. And that's cool. So I didn't know you can apply to both types of programs. Like, one program wouldn't be upset that like you weren't committed to one type of program?
Yeah. No, I mean, they don't know where you're applying. They'll
Oh,
ask like, oh, why, why'd you apply to a 6-year program? Why'd you apply to a 4-year program? And, you have your answer ready for both basically, but they don't necessarily know what you applied to. It's
okay.
nice to know beforehand because you can concentrate all the money and applications towards like just the 4 years or just the 6 years. But for me, it was kind of difficult to really nail down until like match lists were due. And I was like, okay, I need to like be real with myself.
How many schools or programs did you apply to?
I ended up applying to about 40, which I think is a little on the like upper side compared to other people, but I wanted to be safe. I wanted to match the first time around. And so that's why I chose to apply to a little bit more.
And
And I
then
also applied to a variety. So it was like both 4 and 6.
gotcha. So what do you think would like, or how many interviews did you get out of that, if you don't mind sharing with
No,
us?
yeah, not at all. I ended up getting 7 interviews, and I think I was on the low side of interviews for my class. Only my theory was that my letters of recommendation, not that they weren't the best, I just didn't get enough from like oral surgeons specifically.
Gotcha. So okay, so you had a mix when you were sending your letters of rec. They weren't just from oral surgeons.
Yeah, I had 2 from oral surgeons, and then 3 were like our school faculty, like general dentists and whatnot.
Gotcha.
And I saw at least like this is like anecdotal. The other people in my class that actually had more letters from oral surgeons
Mhm.
did way better in the cycle. Like they had so many double, triple the interviews I had.
Oh wow, interesting.
Yeah. And not considering like I had a really high score. So I got an 80. And some other people had like a lower score, but better letters. They got more interviews. But I mean, there's so much that goes into the application. You don't know what exactly. For
Yeah.
me, I was just like, I think everything was great. I think it was just my letters.
Yeah, I'm curious because I know UCLA was pass fail honors. Do you
Yeah.
think the honors played any role in like making your application look better? Does it carry that much weight?
Not really. I don't think it did personally. I didn't have that many honors. I think I had like 2 or 3.
Okay.
I didn't have too many, but it played a role for like some faculty at UCLA that wanted to see the honors to write you a letter of recommendation. Some like wouldn't write you a letter if it was like you had no honors or you had a little bit of honors. Some wanted like X amount of honors to write you that letter.
I see.
But overall, like the bearing in the cycle, like when they look at you, they basically ignore your transcript. Like they're just
Oh,
like, okay, we don't know what honors, pass, fail, anything means.
okay.
At least that was like my interpretation of it. And from like this cycle right now, what I saw with us interviewing and whatnot, it seemed like the pass fail, like nobody really knew what it meant.
Oh, I see. Okay. So then it comes down to like extracurriculars, I'm assuming, plus your CBSE, right?
Yeah, exactly. CBI for me, I put the ranking more at like letters of rec were definitely almost on par with CBSE. Like I have to put them up there next to each other. Again, it's more anecdotal. That's what I saw,
Right.
but definitely CBSE opens the door. Like you're not going to get filtered out. Especially if you want a 6-year program, they generally take the higher CBSEs. And then after that, extracurriculars, and then even doing like a non-categorical internship, that adds a lot to your resume.
So did you do research while you were at UCLA?
A little bit, nothing crazy. I wasn't published or anything like that. I did like a very small project that I worked on for a while. We didn't really get to finish it, but I mean, it was on my resume when I applied, and I was able to talk about it just fine.
Gotcha. Was it something that you were passionate about, or you kind of did just to, check the box?
I was doing it to check the box, honestly, and like there was no need to. I think I would have been fine without it. I enjoyed doing it while I was in it, but it wasn't like the the thing I wanted to do. Like it wasn't like a real passion or a great desire to do research.
I definitely feel that. So, and do you think it matters if you do research, like depending on the program? Like if it's a 6 year, do you think they want more research?
So I think it's more program specific than it is like 4 year or 6 year specific. Some
Oh,
programs really like to see it and they enjoy seeing research. They want to do research. Other programs like don't care for research at all. They're not like if they see it, they see. If they don't care. It really depends. Like it's so varied with research.
interesting. And this is something like I remember hearing a lot while a pre-dent, like the dental students would always tell you, like, get leadership positions because dental schools love to see leadership. Do
Mhm.
you think it's the same for like residencies? Do they want to see you taking those leadership positions in dental school?
I think they definitely do, because part of like being in residency, and especially eventually when you get to your chief year, like you are a leader. You're leading a team in patient care and whatnot. So
Mhm.
I think that leadership experience shows a lot. And I was really big in ASDA at UCLA. So my first, second year, a little bit of my third year, not much of my fourth year. But I was like on, what is it, the district board. I was on like the school board and everything. And it was a huge part of ASDA.
Okay. And I'm assuming like you had to speak on that during your interviews, right? Like they brought that up.
They never brought up ASDA, which was funny.
Oh,
Like
wow.
they always, so the couple things they brought up like the little research project I did. They were just interested in like what I did and like why maybe I didn't get published yet.
Right.
They asked me about like my businesses because I help people with CBSE, and then I work with another friend on helping pre-dentals get accepted into dental school.
Mhm.
And then they just asked me about like my personal statement, kind of my life story.
Interesting. How long were these interviews in general? Like,
Not long at all. I would say my longest was probably 20 minutes. Like
really?
they weren't that long, because I remember like at Parkland there was like 5 12-minute interviews or something like that, and then Emory was like random like dates where it was like 20-minute interviews.
Yeah.
So it really varied.
Okay. Were these online or in person?
I got lucky. There were most of them were online except Parkland and Buffalo. So like my 6-year programs
Yeah, gotcha.
were both in person. Yeah.
Gotcha. Okay. So going back to those letters of rec, how did you go about getting them? Like, do you think did you know ahead of time that they prefer like the letters from oral surgeons? I'm assuming not, right?
Not really. Yeah, I didn't figure that out till about halfway through third year, which at that point it was like if I was gonna go make relationships with the oral surgery attending, it was gonna be really superficial. It wasn't gonna be anything crazy. And I felt like at that time, I felt like maybe just getting one from my GPD or something like that, my group practice director, would have been better. But going back, if I were to do it again, I think initially, like when I was hanging out in the oral surgery clinic a lot, but I was just hanging out with the residents. Like I
Mhm.
should have for sure spent some time talking with the attendings. Like I'd barely talk with the attendings. I'd just hang out with the residents, see what they did, like go to the hospital with them, stuff like that. And I just had so much fun doing that. I totally forgot about the attendings.
I
And like
feel
I need that letter of rec. And so I wish I did that a little more.
How many letters of rec do programs usually require?
I think it's minimum 3 from what I remember, and then a maximum of 5. Because you absolutely need one from like the dean of your school, and then you need one from your oral surgery program director if there is one at your school. And then after that, it's whoever you want. So it's like 3 of whoever you want. So I had the or oral surgeon that's my mentor, Dr. Moncayo, and then Dr. Tom, and I forgot my last one. I'm blanking right now, but
Okay.
yeah, I had one more that wasn't an oral surgeon.
Gotcha. And so this is something I've heard from other residents is they say they put a big amount of weight on externships. And when you do an externship specifically at a program you're interested in, they say it's like that's how you build connections with the residents and that's how you get to see if the program is right for you. So how many externships did you do? And can you kind of talk about how those experiences were?
Yeah, I agree with like externships are definitely one of the biggest factors that helps you match, and like I get to experience in oral surgery too. I did 3, so I did one at MGH, then I did one at Parkland, and I did one at Highland here actually.
Mhm.
And so that's where I found out like this was my top program. Like I came here and I had the best time ever. The residents I hung out with are currently my chiefs, so I knew all of them already. Like one of them, Dr. Middleton, Jason, love him to death. Call him Chief, great guy. We just have like so much fun on service because I knew him before, and when I was there before, he was a great guy. All the attendings were super kind, and I just got to know the program really well. And then same thing. I went to Parkland. Everyone was kind. I saw how much work they did. They're like workhorses over there, and I made those connections. And like I got an interview at 2 of the 3 places that I externed at. And looking back, I could have done some more, but at the same time, externships are a balance between like how much time you have and how much money you have to spend, and like how bad do you want to go to the program.
Right.
So I mean, looking back, each externship was like at a minimum $1,000 because you had to
Oh,
like fly there, drive there, and then you had to like get housing for a week. If anything, like Highland was my cheapest because my best friend was up here, and I just drove up and I stayed with him and I just drove to the hospital and back.
And how did that affect the interview process? Did it make it a lot easier? Because like they knew who you were when they were interviewing you, right?
Yeah, it made it a little more familiar. Like a lot of the residents like remembered me and they were like, oh, okay, like nice to see you again, stuff like that. So you just felt a little more comfortable during the interview.
Okay, I see. And now, so this is something that's like already haunting me as a first year dental student is the CBSE. How did you go about studying for it? Like, can you give us a breakdown on it?
Yeah, that's honestly, it's funny going into dental school. Like I remember maybe it was like 20, 30 of us that wanted to do oral surgery, and then it dwindled down to like 10 that ended up matching at the end.
Mhm.
So when I at the time when I was studying, I did a lot of research, and the problem is like it's step one in medical school, like it's USLME step one. And so I saw a lot of the medical students' resources, and the problem with their stuff is like they get an 8 weeks, 12 weeks dedicated study period after they've been taught the material for 2 years straight. Whereas like we, unless you're going to like Harvard, Columbia, or whatever school has a med school curriculum now, you don't get that curriculum at all.
Mhm.
And so I started off with like Boards and Beyond because Boards and Beyond was a big review like of everything they learned in the medical students they learned in medical school. That and then I paired it with sketchy pharmacology and microbiology. That kind of laid the foundation for me to start running Anki decks. And that just provided a lot more information, a lot more like memory retention, the whole like spaced repetition really helped out. I still use Anki to this day, also in residency. After that, I went more into I like downloaded the slides on Boards and Beyond, and I started reading those slides. And along with that, I would read First Aid, which is like the holy Bible of taking step one. Like you read 10 pages every night before bed. And I was still doing Anki. And then eventually, like you get to a point where like, okay, you're very familiar with a lot of the topics. You move on to UWorld, which is the big question bank. And it's not just a question bank, it's a learning tool. So a lot of people will also get discouraged by UWorld because you'll start off with getting percentages that like you'll get 20% of the questions right, which sounds terrible, but I remember looking at like medical student forums and they whatever math they did, that was crazy. It was like a 55% on UWorld correlates to passing step one, which is like a 70. That's a good score. That's what we need.
Right.
So starting at a 20% isn't terrible. And you slowly work your way up. UWorld teaches you a lot. And you get to a spot where you get pretty comfortable. And then you can supplement it with other question banks. And you can continuously like read from First Aid, do the Anki cards, and all of that helps you so much. Like that's kind of what got me to the point where I was at. Like I got lucky also because of COVID, so I had a lot more extra free time. I didn't have to like go to lab for that entire quarter, so that saved a lot of time. And so I was doing like full 8 hour days for 4 months straight, and then we had to go back to school, and then it was 2 months of going to lab, running home, or I'd get up at 4 in the morning, study till like 7, go to lab, come back at like 4, and then study the rest of the night. But really, I think the best study plan that I've seen, and like I help people study for this test now too,
Mhm.
it's a year-long study plan. Because the nice thing about that is that it allows for some leeway in the studying because you still have dental school. That's the biggest problem.
Yeah.
You have all these labs, you have all these quizzes, tests, all this ridiculous stuff you need to do. I say ridiculous because I was just so focused on CBSE at the time. It's not ridiculous. You're a dentist first. Um, yeah, but you have all this stuff you need to do. There's days you can't study for the CBSE. You really can't. So you got to take days off, and that 1 year really allows the leeway. And as long as you're doing Anki, that spaced repetition's there, so it helps.
Yeah, exactly. And I think that's gonna be my plan too. I think it's gonna be insane to be doing 6 to 8 hours a day on CBSE and then do your dental school work on top of that. Like that does not seem sustainable. And I think you're right. Like if you do this in a year, like you just give your mind like more like what is it? Repetition, right? That's all it is. And I feel like that's the new way going forward. 'Cause you're not the first one to say this. I feel like I've heard other not residents, but dental students say like, yeah, I spent 13 months studying for this. And I do think that's like more sustainable at the end of the day.
Yeah, exactly. Because if you burn out, then you're in big trouble. Then you're taking like a week, 2 weeks off. You're not gonna have the motivation to go back. Like your number one problem studying for the test is burnout.
Right.
And you can't like realistically, like during a normal dental school day where you're there 8 to 5, you can really only study 2 to 3 hours. And if you try to pull off, like, you can pull off the 6 months, you don't have a social life. Like, you're not going out with your friends, you're not doing anything. And I did it at a perfect time where everybody was locked down. So nobody was going anywhere. Everybody was at home. So I just did it studying.
Yeah, that was a good time to be productive for sure.
Yeah.
So my last question for you is now, like, you've gone through dental school, you're now a resident, you've even done interviews as a resident. Like, what advice do you have to dental students who are interested in oral surgery, and like, what do you wish you did differently when you were a dental student?
So what I wish I did differently, what I think I recommend for sure, number one, like, get in your oral surgery clinic if you have one. And if you don't, look for outside oral surgeons you can shadow and really start finding out as soon as possible, like, is this the field for you? Because if it is, you need to shadow some people, make sure you have those letters of rec secured, and then move on to taking the test. And then focus on the test. And then at some point, you'll get your extracurriculars. You'll do whatever you need to do to, like, spice up your resume to make yourself more interesting. But I'd focus immediately on, like, letters of rec, CBSE, because the faster you can knock those out and secure a good score, secure some letters, you can move on to actually doing what you love to do. Maybe some people, you love volunteering, you actually love ASDA, like advocacy, you love doing whatever it is you want to do, you can get to that faster.
Perfect. And if our viewers have any like further questions for you, is it okay if they reach out to you like via email or Instagram?
Yeah, Instagram definitely works. You can tag me for sure, and Instagram's a perfect venue for me to, like, respond to people.
Perfect. Yeah, we'll leave that in the bio of the video. Naseem, thank you again so much for your time. Really do appreciate it. I feel like I know I definitely learned a lot, and I know the viewers are gonna learn a lot from this too. Let me make sure I remember my outro for this because it's been so long. Guys, if you like this video, make sure to give it a thumbs up and subscribe. And if you have any questions for us at FutureDDS, you can always DM us on Instagram @_FutureDDS, and we'll try to reply to you as soon as possible. And until next time, see you guys.